Woman Summit virtual workshop series. My name is Sherica Hymes. I am the founder and host of the Total Woman Summit, and I will be your host today. Today, we are so grateful to have with us our speaker, Dr. Theresa Woodard. She will be discussing with us today, what is COVID-19 and how do I stay healthy when stay home is over? So we will get right to it. Welcome, Dr. Woodard. We are so happy to have you today. How are you?
I am well. Hello, Sherica. Thank you so much for having me. I appreciate you giving me the opportunity to share.
Absolutely, absolutely. So for those of you that are new to the Total Woman Summit, the Total Woman Summit was created to empower women through education, connection, and community. And as a part of our commitment, we are always bringing you the subject matter experts who are discussing the topics and things that you want to discuss in a real, relatable way. And when we thought about the right doctor to talk to us about COVID-19, what it means, what you can do, and answer all of your questions, there's no other name that came to mind first than Dr. Theresa Woodard. So Dr. Woodard, would you tell us a little bit about yourself and why you're passionate about the work that you do?
Sure. As she has stated, I am Dr. Theresa Woodard. Some of you that followed Total Woman Summit may remember me from the initial debut session that we had, which was awesome, and that was just a few years ago, and everything has grown, tremendously since then, which I think is great. What I do because I have a passion for disease prevention, education in regards to health and wellness. I am an internal medicine physician. I've been practicing medicine for over 20 years. And within the past few years, I've developed a health consulting agency, TW Med Consulting, where we do adjunct work with corporations and businesses to help them have a more in-depth and more flourishing wellness program for their employees.
Awesome. Thank you so much for sharing that. So let's get right into it, Dr. Woodard. So many people are talking about COVID-19 or the novel coronavirus, and I really would like to just explore that. Tell us, what is this?
Okay. Well, you're hearing people say the novel coronavirus, and basically novel just means new. The coronavirus has been around for years, but in very mild forms, what we would usually consider the common cold in humans, and it's also seen in pets as well, but in mild form. So it's novel coronavirus now, more specifically novel beta coronavirus, basically meaning that it's a new form of the coronavirus. COVID-19 itself basically stands for, the CO is corona, the VI is virus, D is disease, and 19 is because of the fact that the initial findings were found in 2019 in Wuhan, China. So that's where COVID-19, that acronym, for lack of a better word, that's what that means. That's what that's for. And rarely does animal coronaviruses spread to humans, but that's what makes this one so different, is that this is a rare form of the coronavirus that was initially found in bats that has in some way spread into humans and allowed for human to human spread, i.e. the current pandemic. And this is very similar, the COVID, this COVID-19 virus is very similar to what we have heard before in the news from years past when people have talked about SARS or people have talked about MERS, because both of those viruses, as well as this beta coronavirus, have all originated from being transmitted initially from a bat to a human and then allowing human to human spread.
Mm-hmm. You said the DO, I got CO for corona, VI for virus, and the DO, I'm sorry, what is that again?
D is disease. And 19 is because it was initially reported in 2019 when officials from Wuhan, China, made the report on that.
That is so awesome to know this. And when you talk about the virus being similar and having been around for years, there is a lot of conversation from the naysayers that believe that this is a hoax, or for the people that may be minimizing this or those who are swinging back and forth trying to determine if they believe that it's real or that it's just an over-exaggerated version of the flu. Can you talk a little bit about how it is different or how it is unlike the flu?
Sure. Well, COVID-19 is unlike the flu in that it is 10 to 15 times more lethal than the flu, meaning if a person gets the flu versus a person getting COVID-19, you're 10 to 15 more times likely to die from COVID-19 versus you having the flu and dying from the flu. So it's highly lethal compared to the flu. And people are downplaying it because they're like, we have so many cases of the flu worldwide every year, even more cases than COVID-19. And that in of itself is a blessing. And you should be thankful that we don't have as many cases of COVID-19, because with that being said, so much more of the population would be passing from this. So COVID-19 is real. COVID-19 is much more lethal than the flu, the typical flu. And also there are other questions with COVID-19 that we really don't know the answers to at this time. For instance, we know that flu is seasonal. You know, we'll usually get it in the fall. People that believe in vaccinations get their vaccines in preparation to prevent them from potentially getting the flu, because they know that fall and winter is a large flu season. With COVID-19, we really aren't sure. We are hoping that it is seasonal like the flu, but from all indications of what's been going on, it very well may not be. And we say that because you have to think of places, because this is a pandemic, meaning it's affecting the whole world. And places such as Australia, which is basically during the flip season of what the season that we're in now, you know, they're having just as many, you know, just as high of an incidence of the occurrence of COVID-19. So that means it may be spring and summer here, but it's winter in other places, and they have it and they're dealing with it, and people are dying.
Wow.
And that means, okay, this may not be as seasonal as we would like it to be. So that's another difference between COVID-19 versus the typical influenza A or influenza B that people are used to going to be treated for with their physician or in the hospital.
You bring up a very valid point, because so many people have said, and I've heard myself, people say, oh, the summer is coming, it'll kill it. But to make that point that it is a different season in other parts of the world, and they are actually still experiencing this virus at the same rate, really doesn't give us any indication that the summer will kill it. So that's a very great point that you've made for us. And then you talk about the newness of the virus. I've spoken to so many of my friends who are doctors and nurses and nurse practitioners who talked about just how differently this virus represents itself for so many different people. Can you speak to that?
Sure. The initial symptoms that came out with this virus were the fever and the cough. And then it evolved, meaning that, you know, people started having more symptoms. And so then that changed from fever, cough, sore throat, maybe headache. Then people began having other symptoms such as shaking chills, even though they weren't necessarily showing a fever when they checked with a thermometer, but were having shaking chills, loss of sense of taste and smell. And that being the only symptom. Like, you can have all of these things, or you can just have one of these things, and people have still shown up to have tested positive for this. There's also the newer one that I've been hearing about are the COVID toes.
Wow, what is the COVID toes? Okay.
So it's not funny, but it's just funny when you put those two words together. COVID toes, what in the world? But COVID toes, if people have heard that or seen that, even though none of it is funny, but you have to kind of get your comic relief in where you can, because we've been dealing with this for such a long time. But I think it's a cute name. But COVID toes are actually being found a lot in children, and we're not hearing a lot about children on the news, but this has happened in the pediatric population, where a group of one or two of the toes, is usually not all of them, you know, and it's usually asymmetrical, meaning that it's just on one foot versus both feet. And they'll have two or three, you know, 1 to 2 or 3 toes that have gotten a little swollen, gotten a little red and looked like a typical cellulitis. Cellulitis meaning an infection of the skin. So it looks like the toes are kind of like little sausage digits.
Wow.
It may be a little swollen and infected when in fact, for, probably just for general, more of a, let's say with kids, they tend to do more of screening, when necessary. So they just, perchance these children were tested for the virus as well, and it comes from that they're positive, and this is what they're seeing. So now they're correlating this skin manifestation with the disease in a pediatric population. And so the COVID toes looks like a little skin infection on the toes, and that's pretty much the only sign that these children are getting, but then they're testing back positive. So that's another symptom, that's popped up. So, and that isn't to say that this is the last thing. This is a pandemic. It is affecting us worldwide. So there may be something that's coming up consistently that we just haven't noticed yet, that we may have reported, say, 3 to 4 weeks from now, as part to the symptom, the symptom diatribe as to what to look for and what to think of screening someone or testing someone for if they present with this, say, to an emergency room or to an urgent care clinic type setting.
Wow. So every day it sounds like that there's a new way that the virus can manifest itself. And so we all can be looking for all the symptoms. It may represent itself in a variety of ways. That's important to note. So does this virus only attack our aging community or our seniors? Because there's so much conversation around that our youth are safe. If you're healthy, you're safe. Can you speak to that?
Sure. It is attacking mostly people that have coexisting conditions, meaning that they're dealing with chronic illnesses already, such as diabetes, kidney issues, cancer patients undergoing treatment, immunocompromised patients that may be in need of medications by injections or by IV. So that is a larger percentage of the population that is being tested and being found positive. These are people that have chronic or coexisting conditions. A lot of that tends to happen with age because you live long enough, you go through a lot of things. There's a chance for multiple issues just throughout your life to coincide until you're having some of these chronic conditions. But this does not mean that this is just for the elderly or a disease that is quote unquote attacking just the elderly. There are people that range from the age of 30 to 50, especially in the state of Tennessee, that has just as much of a percentage, of positive testing as to those that are 60 and older. And then, of course, there's also the pediatric population, which we don't speak of much in the public, and I can only briefly talk about that, but there is indeed a rise in the case of pediatric patients that are being found to be positive with disease. So it's not just the elderly, but we are concerned about the elderly because most of the time it's the older or more mature adults that tend to have chronic illnesses. But we must keep in mind that there are 30, 40, 50-year-olds that are walking around having had a kidney transplant or a lung transplant or suffering from rheumatoid arthritis or, things of that nature that put them at risk as well.
Well, thank you so much. I appreciate you putting some meat around that, Dr. Woodard, because we want to make sure that we answer those questions. And then, so you make a very valid point about saying that, yes, those who have coexisting diseases are much more susceptible. But can you help us understand why those who have existing conditions or coexisting conditions or compromised immune systems are so susceptible?
Well, part of that is the fact that these coexisting conditions tend to decrease your immune system. And immunity is what we as humans use to naturally fight off any disease, whether it be a cold, virus, insect bite, any things of that nature. So the coexisting conditions over an extended period of time, especially when they are not controlled, meaning that your blood pressure isn't controlled and you've had hypertension for 10 years, or your diabetes isn't controlled and you've been struggling with this fight for, the last decade. Those things, especially when not controlled, tend to decrease your immune system. Just chronic lack of sleep can decrease your immune system, but usually
Oh,
people can get over that. People can take medication to help them sleep, so that doesn't put them in that chronic state of decreased immunity. So the immune system is what we naturally use to fight off disease, and anytime that is compromised, we're at more risk of disease, whether it be of any type. But the fact that COVID-19 is such a lethal disease, it is really easy for those people to be susceptible, just like they are susceptible to everything else. Like they would be more susceptible to the flu, they would be more susceptible to just a simple respiratory infection. But COVID-19 being as lethal as it is, make them a quote unquote target for the virus because they're already in a weakened state.
okay, thank you so much. And so we have a question before we get back to that conversation. And you guys, you can talk to us while we're talking. If you need any more clarity about something that we're talking about or something that you've heard that you'd like for us to address, we want to answer those as the conversation is flowing. So here's a question from one of our participants. Is borderline diabetes sugar level that range from 110 to 125, could that be considered underlying chronic illness?
It shouldn't be taken lightly, that's for sure. At that point, you're not necessarily diagnosed with diabetes, but you're at still maybe a slighter higher risk than a person that that's walking around and has a sugar of 80 to 100. So definitely don't take this lightly. This doesn't necessarily put you in that category that they speak of on the news, but you are tipping, you're walking that fine line of being at a greater risk. So at this time is definitely the time for you to be more diligent about following a proper diet, getting the sleep that you need, checking your sugars if that's what you normally do, just to kind of stay on top of your borderline condition in between your doctor's visits, contacting your doctor, using your telehealth services if they are available to you to learn more about what you can do and things of that nature. So you're walking that fine line. And I would tend to say, if it was me speaking of myself, I would say, okay, well, that means that I'm even closer to being susceptible and possibly getting this versus if I was even healthier than I am today. So what can I do today to continue to be healthy or to get back to a healthier lifestyle?
Thank you so much. So, Dr. Woodard, when you say that folks who have coexisting conditions and those who have chronic illnesses are much more susceptible, does that mean that if I am fairly or reasonably healthy or extremely healthy, that I am not at risk for catching this virus?
That does not, because there have been people that are, as they say, healthy as a horse and are still, catching the virus. It is a highly lethal virus compared to something like the flu, which is what a lot of people are comparing to. That's why I continue to bring that up. So you can still be very healthy and still catch this, especially if you're not practicing the precautions that people have been sharing as far as the social distancing, staying physically 6 feet away from people while in public. Now they're requesting that you wear a mask in public now, whether you have it, whether you don't, whether you feel good or whether you feel horrible. So those type of things, the hand washing, the sanitation, the cleaning, things of that nature, just practice. I've been telling my patients, just act like you have the virus. I've been saying that from day one, act as if you have it. So think to yourself, what would I do if I knew that I had this virus, or if I was ill? What would I do to protect myself? What would I do to protect my family members? What would I do to protect the people I must come into contact with in regard, like if you are an essential worker?
Mm-hmm. Thank you. And so what can I do? Like, I'm someone who is in fairly reasonable health, praise God. I don't have any known conditions outside of allergies, which I take medicine for every day, and that's over the counter and prescription. But I also have a really strong, consistent vitamin regimen, which brings me a certain amount of comfort. What are your thoughts? What can we do to strengthen our immune system? Or am I just fooling myself with this vitamin regimen that it's helping me? Or not because of the COVID-19. Let me be clear on that. I've had a vitamin regimen for years that I take, but yeah. So give me your thoughts on that.
Well, part of, there is, I'm not saying that vitamins are a placebo effect, but part of that is the placebo effect. So if you're doing something and if you're having the mindset that this is
No, not the
you're going to feel
placebo.
better. but I'm not knocking vitamins. I am not knocking vitamins because I take them myself. So there is a place for vitamins. There is a place for vitamins for specific people. So I'm not knocking the vitamins. But all that to say, health is more than just the physical. So the fact that you taking vitamins and you getting good rest and you're taking your allergy medication, part of that helps with your mindset. And health also deals with the mental, it has a mental portion to it too. So the vibes and the serotonin that's released from you doing the things that are good and healthy for you, that also helps promote better health. So there's a portion of that helps, indirectly, that's helping you and helping boost your immune system. Okay, now vitamins specifically. In regards to increased immunity or maintaining immunity or helping yourself kind of boost up your immunity, there are a few things that are out there where clinical studies have shown to help. So I'm going to talk about the ones where I've read where clinical studies have shown to help. And people may be doing a lot of other things, but I'm just sharing what I know. Okay.
Okay, I'm going to drop these in the chat. Go right ahead.
So specifically in regards to viruses, it's definitely good to have a good regimen or a good level of vitamin C and vitamin D. Part of your
Dr. Woodard, so there are a lot of different vitamin Ds. I know I take a D3 and a D12, a D3 and just a regular D, I think, or something. Am I getting my Ds and my Ds mixed up?
What's happening here? A D3 and a D2. Okay, so
okay, great. I'm doing both of those. Okay.
That's fine. A lot of people promote doing a little bit of both, D2 as well as D3. Some people only take one or the other. The point is they're both needed. They both help each other. They work with each other, So all that to say, physicians now with your annual physicals are now beginning to check for vitamin D, especially if you're over the age of 40 or if you have, like we spoke of earlier, any of those chronic or coexisting conditions, because studies have been shown that decreased vitamin D levels can also indirectly decrease your immune system. So now people are making it a part of your annual screening if you fit into certain categories to check your vitamin D levels to see if indeed you are deficient. A lot of people think, oh, I get out in the sun, I get my sunlight, because of course, there is the vitamin D that we do get from sunlight, the UV sunlight, and it works through incorporating a whole bunch of mechanisms with the kidney and the gut that we're not going to get into today. But even those that spend lots of time in the sun can still be found to be vitamin D deficient. So in regards to helping to maintain a decent immune system at this time, I would recommend that you are doing a vitamin C and a vitamin D. With vitamin C, we're speaking of at least 500 milligrams doses, and you can get these over the counter. A lot of vitamin stores have them. And in regards to the vitamin D, at least, well, that's where things get a little sketchy, because certain doctors feel certain ways, is just as certain herbalists and naturalists feel certain ways. So at this point, I will remind you that this is for education and entertainment. Do not take what I say as a prescription, because I am not your doctor. And if I am your doctor, I am not now in the office. And so this is not pertaining specifically to you. But in regards to something that someone may want to take over the counter, I would recommend at least a vitamin D of 1,000 to 5,000 international units per day. Okay.
Well, tell me again. I have to put that good disclaimer in there.
Vitamin D in 1,000 to 5,000 international units per day. Okay. Those are doses that you can readily find available over the counter. Now, People that
5,000 to
have
1,000? Did you say 5,000 to 1,000 or 10,000?
5,000. We're talking per day, 1,000 international units up to 5,000 international units, or IU. It would look like a large capital I, capital U per day. Now, I do caution people that have issues with kidney disease. If you are a kidney patient, then you need to speak with your doctor as far as the proper intake of any vitamin, because people that have kidney issues can't necessarily process a lot, a variety of vitamins a certain way. So anyone with chronic kidney issues should really contact their doctor, because their doctor knows their filtration rate, all the fancy stuff. They knows how well their kidneys function, and so they know what will be safe levels in regards to additional vitamins and minerals for that person. But for a typical healthy person with no underlying conditions, wanting to do something to help maintain a happy and healthy immune system, and is interested in supplementing that, through a pill or a capsule, then vitamin D and vitamin C is what I would recommend, which is the same thing I would recommend, say, during flu season. But this is a pandemic, and this is happening now, and potentially all year round. So that would just be something good to put in your regimen. Okay, if you're already taking a multivitamin that happen to have those amounts or close to those amounts in each tablet per day, okay, if it ain't broke, don't fix it. Leave it alone. You're already covered. You already handled it. So that is fine. Kind of hope that helps with that.
Absolutely. Thank you so much. And I did put the disclaimers at the top and at the bottom. We do want you to make sure that you see your personal physician before starting any regimens. This is just for educational purposes. Dr. Woodard is not your doctor, so you need to speak directly to your physician about your personal needs. So let's answer a few questions real quick. And this is a perfect segue actually into this question. So I'll ask you this first before I ask the question. So if you've taken the flu shot, are you at risk, or are you better protected against the virus?
The COVID-19 virus?
Yes.
You are not protected at all, because influenza is a totally different virus from beta coronavirus or SARS-CoV-2, which is the fancier name for COVID-19. They're two totally different entities. The flu vaccination only protects you against flu strains. The two common strains that most of these vaccinations protect against are A and B, because they are the two common that humans tend to get during the flu season, influenza A and influenza B. When you go in and you have like a rapid flu test done in the office, that's what we're checking for. Some people end up having both strains, which calls for a certain medication. Some people only have B, some people only have A. And based on what your results are saying, when you have that flu test done and it comes back positive, our line of treatment varies. The medication that we give you varies depending on what comes up positive on the test. But having been vaccinated for the flu does not protect you at all from COVID-19. I had my flu shot too, and I'm still doing everything that I can to, stay safe so that I do not get COVID-19.
Okay, thank you so much. So here's a question. As a skeptical community, how can we know taking the annual flu shot in the fall is safe to do so?
In regards to the flu or in regards to COVID-19? That's the other thing. If you're speaking in regards to the flu, if you've ever had the flu, which I have, having that flu one time was enough to convince me to make sure I get my shot every year religiously. Even if I wasn't in the healthcare field, I would still be getting that shot every year as recommended. But honestly, as a frontline worker or as someone that works in the healthcare industry, we are required to get the flu shot each year, because number one, we don't want to have, say if we have a mild version of the flu, same thing with COVID. If you have a mild version, you don't want to walk around as a physician or a nurse, or an EMT treating patients and indirectly give them the flu, just because your body can handle it doesn't mean that they can handle it. So as a medical doctor, I do believe in vaccinations. I realize that some people don't. There are certain groups of people that we really try to recommend to take this, but I can't make anybody do anything. I can't. I can only give recommendations and do my best to do no harm. And the group of people that we do recommend get the flu shot each year to protect them from the flu, not from COVID-19, are, again, diabetics, people with serious lung disease like COPD, people with kidney issues, cancer patients, people with immunosuppressed symptoms, people that work in the healthcare industry, people that are over the age of 60 and have had the history of pneumonia before. Because with the flu, it's not the flu that kills you. With the flu virus, it's the subsequent pneumonia that you get and respiratory collapse that kills you in most cases. So
Okay.
I do recommend the flu shot, or the influenza vaccination, another name for it, for people that fall into those categories for sure. If you're healthy, then it's up to you. You can choose to take the flu shot each year or, not. But people that need that protection really should get that protection because of the fact that the vaccinations are readily available. And just an offshoot on that, when it comes to vaccines, we do not put, we meaning, the scientific and medical community, do not put vaccinations out unless they are shown to be 95% or greater effective. So, all that being said, the flu shots, the influenza vaccination given each year is to do what we can medicinally to prevent you from getting the flu that year. Does it always work? No, because what we also have been seeing over the past 5 years is a higher mutation rate in all of the influenzas in general. So flu has been harder to stay, quote unquote, on top of because it's been changing a lot more in these past 5 years than it was a decade ago. Okay, because people are like, well, I'm not going to get the shot because I'm going to get the flu anyway. Well, that may happen because the virus is changing, but if you're healthy, it's up to you to decide. If you have any of those conditions we listed earlier, we really recommend it. Some people still don't do it, but a lot of them eventually do because this is just another precaution trying to keep them out of the hospital, trying to decrease their hospital stay, trying to prevent them from getting, ill with a pneumonia or something that may end up putting them in the ICU, may end up running up their hospital bills, may end up changing the way that they're able to control their diabetes. So it's a trickle down effect when it comes to, it can be expensive both physically and financially in some cases.
Thank you so much. So our next question, rheumatoid arthritis and taking biologics. Should I continue taking these infusions or injections during this time?
Well, if this is what your doctor has recommended that you do in order to, maintain your health and stave off the effects of your disease, then it's between you and your specialist, your physician, to figure out how to schedule you in the safest way. There are still people such as yourself that need to have injections, or say cancer patients that need to get infusions where they're being put on a set schedule. They're doing their best where they can, schedule patients' appointments where there is still social distancing and safety in regards to you having to go to an infusion center or to a hospital to have these done. Some people can do this at home, and that's great for them because they are, home, they're educated on it, and they're safe. But if you're having to go somewhere to get your infusion, I still recommend you do what you need to do to maintain your health. Just make sure that the facility that you're working with is also doing all that they can do to help maintain your safety in regards to the COVID-19.
Thank you so much. So here's another question. How effective is ginger and turmeric?
In regards to?
In regards to what? The person that the question, can you give us a little bit more information so we can better answer the question? And they had a second question.
Sure.
I'm concerned with vitamins, especially when you put them in a glass of water and they don't dissolve. Should I be concerned about this? I can't imagine this helps in the body.
Well, now we're switching over to, we're moving totally away from COVID-19, which is fine
Okay.
with me. But now we're switched to a vitamin seminar. So when it comes to vitamins, my thing with that is some of my issues with vitamins are the majority of vitamins are not FDA tested, meaning the Food and Drug Administration does not test them as they do the medications that we use, such as your blood pressure pill, or things of that nature. So that's one issue. So what you have to do is you have to really do your research. If you're going to be a vitamin consumer, then you must really do your due diligence to look at the research from those companies. How are they making those vitamins? What are the additives? Because most vitamins do have additives in them to make them compact into that little tablet, to make them look orange or yellow or red, So all of that has to be taken into consideration when you decide that you are or are not going to use vitamins. I personally myself use a brand of vitamin that does no additives, that comes in capsule form, that every capsule that I get from them, I can open up and I can put it in water, or I can put it in something else and it's going to dissolve. So, that's, and those are the only ones that I take. So, but I have done my due diligence. I know this guy to be, a science guy. I know him to have a lab that is general on the community, has a low carbon footprint. They're more expensive, but I believe in the work that he does. And because I believe in the work that he does, I feel safe putting his vitamins into my body.
Are you willing to share what brand those are? We have a couple of people asking.
Sure, that is Andrew Lessman, AndrewLessman, I think it is. It may have a second.
I'm familiar.
Yeah, so I use his products because of the science that's behind them. And I agree with most of what he says when it comes to the research. Not everything, but with most of what he says when it comes to research. He does not use additives, which I can appreciate for my own health issues. And if what he says is usually true. For instance, he has a fish oil supplement out, and those are those things that look like the little gel caps. And most people that have ever took fish oil supplements know you get that fishy aftertaste. He says his doesn't, and it's true. They do not. If they do, you're getting a total refund. You may have gotten a bad batch, but I like those because they don't give you that fishy burp after, but that kind of thing. So his own products I tend to use. I do use other people, but 90% of any vitamin that I use is going to come from him because I know he's already done the science behind it, so I don't have to.
Okay, thank you. And this is going to be our last question on this particular topic, and then we're going to shift. Okay. So as it relates to ginger and turmeric, are they healthy? Are they good for general health and well-being?
I believe so. Yes, they are. Okay. There are actually studies. I believe so. Number one. Number two, yes, I have read studies on ginger and turmeric, whether you're using the extract, whether you're using the fresh, root itself. I actually use ginger and turmeric myself for its anti-inflammatory properties because I do have arthritis issues. Y'all getting all my business right, but I do. But I use that myself, and when I do, I'm using the actual root. I'll go to the store, I'll get fresh ginger, fresh turmeric, or I'll use a powder, of a brand that I know there's only that in there versus all the other additives and stuff. And it does help me. I've read the science that says it helps. And when I use it, it does help. So I'm down with ginger and turmeric.
Good deal. Thank you. So something that we absolutely must discuss, Dr. Woodard, is, and you helped me last week educate me on this, that quarantine, isolation, social distancing, and stay home are not the same thing. So let's discuss that a little bit.
Okay, yeah, it's sure. So when people say social distancing, basically what they're talking about is physical distancing. And some people are using the term physical distancing now, but that just means keeping a space between you and the people outside of your home. That's all social distancing is. We've been hearing about it called that 6-foot rule. No public gatherings over 10 people, staying away from crowds, but social distancing equals physical distancing. And when it comes to the public space, we're talking about greater than 6 feet. I may have said 10, but greater than 6 feet. And then no large gatherings and things of that nature. So that's social distancing. Isolation, social isolation, when people say that, basically isolation means separating the sick people from the healthy people. Okay, so that's what the isolation means. You're separating people that have COVID-19 from people that are known to not have COVID-19. With quarantine, which is what most of us are doing, it is separating a person or a group of people that have been exposed to the virus to limit further disease spread, meaning you're separating people that may have possibly been exposed to the virus, but they're not sure. Some have symptoms, some don't have symptoms, but you're keeping them separated, from the general public, whether it's just you quarantining in your home or an office, quarantining workers in a building. I think they had a lot of travelers from the reports before, like some, traveling back to the United States, where everyone that traveled back had to go and stay at a hotel for 14 days. That was quarantining those patients, because they could have potentially been exposed to COVID-19, but they were not sure. And so they were quarantined from general population versus just letting them go out, all willy-nilly and possibly spread the virus even further. And the quarantine is established usually during the incubation period for any disease. Quarantine that we've been hearing about is the 14-day period, because what they have found is that with COVID-19, their incubation period is anywhere from 2 to 14 days, meaning the date that you have been exposed to the virus compared to the date where you actually start showing symptoms. Some people have shown them as early as 2 days, whereas some people take as long as 14 days. And they've taken the average of that, from all the people that they studied when this first came out, and decided to go with the safer number being 14 days, because people, were without symptoms up until that time frame before they actually started to have one of the symptoms that we mentioned earlier. So quarantining is basically taking a group of people you're unsure if they have the disease for a certain amount of time, for COVID-19 being those 14 days, to discover whether or not they're disease-ridden or disease-free.
Thank you so much. Yes, absolutely, it helps. And just for clarification purposes, none of us who are practicing stay at home or safer at home are quarantined. We are practicing safe social distancing to prevent the spread of the virus and to flatten the curve, right, Dr. Woodard?
Right. Now, there are some people that are home because they have tested positive and they are on quarantine. You're quarantined. Okay. Yeah. But you're either doing one or other. You're either, being isolated because you don't have it and you're not trying to get out into the environment or into the public and potentially get it, or you're quarantining because you've been tested and your test is positive, and so now you are trying to stay in your space to prevent giving it to people out in the public, who can then give it to other people, who can then give it to other people, which is really part of the issue of the seriousness of COVID-19. This is an exponentially growing virus, meaning, we're going from 2, from 2 to 4, from 4 to 16, it's exponential. And a lot of people, I guess, some people are getting that, but the fact that it's exponential means that it can spread within a matter of a month to potentially thousands of people. And we won't get into the science behind it with the R0 and all that stuff. But when it comes to this particular virus, the R0, that's that number you want to be less than. Well, anyway, this one's greater than 1. If it's greater than 1,
new for me. I was like, huh?
Yeah. I'll have to say the science behind this virus is stating that it is highly, and highly growth is exponential, meaning if you have this virus, say if 2 people have the virus, in a matter of 30 days, that 2 turns into a couple of thousand. Because the R0, that science number that we look at as far as this infectivity rate, is greater than 1. Okay. It's actually, most studies I've read puts this R0 between 2 and 2.7, which is really high. But what we want that number to be less than 1, because it's easier to control any spread when it's less than 1. But when it's greater than 1, that's when we have what we now have is a pandemic. And you have to think, So this is a pandemic, meaning it is affecting pan, the world. The R naught number isn't even like 2, you know. So what if it was 10? You see, we're just at a 2 with COVID-19, and we have millions of people affected and tens of thousands of people already deceased from this. So it is serious. And I just and we're sharing today because we want you to, you know, practice, you know, safe practices and do the best that you can to either stay healthy if you've already contracted the virus, or to stay healthy and stay in the effort of not contracting the virus. And we hope that this has been helpful for you guys, and we'll take a few more questions, and I'll see where you want me to go next, Sherica.
Absolutely. So now I want to go to, we talked about just how serious the virus is, really giving a little bit more depth of thought and structure around sort of what it means to have it, the differences, how it spread, what you can do. So now I would really like to shift our conversation to how the virus is actually spread and why people, and how they can protect themselves and their family. I, for one, went out yesterday. I'm only leaving my home when it's absolutely necessary because it can be ordered and delivered. That's how I'm living my life. And for full transparency, that's how I live my life anyway. So this is right up my alley. But I had to go to Home Depot yesterday. And when I tell you it was like the Mid-South Fair, I was so afraid, but I had on my gloves, a fresh pair of gloves, and I had on a fresh N95 mask. And I was so concerned, less than 5% of the people had on any personal protective equipment. Can you talk to us about the virus, how it spreads, and why we really need to be wearing this things to protect ourselves?
Sure. Well, COVID-19 is spread through respiratory droplets. This means if someone coughs on you, sneezes on you, you know, or in your vicinity, i.e. the 6-foot rule, because usually most coughs and sneezes, you know, those aerosols, those respiratory droplets can spread out that far. A simple sneeze from a 2-year-old can hit you if you're 5 feet in their circle. You know,
so that means that if you are in an environment where no one is wearing PPE and they sneeze and they have walked off, you can walk into the midst of those respiratory droplets that are in the air, but by covering your face with the proper equipment, you are protecting yourself from what's being transmitted in the air.
Right. It's definitely helpful because the respiratory droplets can linger, and that's why they're wanting people to wear masks, even if they're homemade masks at this point when out in public, because it does give you some level of protection. Okay, so let's see, we'll try to explain this. So from least protective to the best protection we can do at this point. Least protective, 2 people out, 1 sneezes, you know, easily transmitted. You know, just think, you know, envision, you know, 2 people standing across from each other, even if it is 5 feet or so, then they're just talking. And then one of them coughs. That's the least protection. They don't have on a mask, you don't have on a mask, it's easily transmitted. Next step, you're out, you have on a mask, someone that you're speaking to coughs. Okay, you're somewhat protected because you have on a mask. That doesn't make you 100% protected, but it does protect you and bring your risk down some. If you have on your mask and that person has on a mask too, but then they cough, it's better protection because their respiratory droplets, most of them have been encapsulated in their own mask. The few things that do get out don't necessarily make it even as far as you are, but even if they do, then you have on your mask as a barrier. You see what I'm saying? And then, so the mask wearing in public is basically to do that, to give us the best physical barriers we can obtain, you know, with ease, you know. Okay. And this doesn't necessarily drop the risk of getting COVID-19 to 100, but it definitely drops it to a much lower percentage than if both of you guys were out without masks on, someone happens to cough or sneeze or whatever, you know, as far as that potential. So I hope that helps some. and this is just with just a homemade mask or a simple surgical mask. We're not even talking about the N95 mask, which we're really trying to, reserve. Some people are blessed and have them. People that do construction work, and stuff like that. Men and women that do that type of work may have had access to them because there is an industrial form of an N95 that is just as safe as medical form. And there's also like an N99, but people that, carpenters and stuff, they know what I'm talking about. But so those masks we are reserving for the frontline workers, the EMTs, the firemen, the policemen, the healthcare workers, the nurses, those people. So if you have extra masks, by all means, reach out to these local places and share them with the people that really need them. And these sort of people that are treating these people in, day in and day out. But that's even more protection than just the simple scenario that we gave. So, and the other thing about the hand washing and the use of the alcohol, that's because, say, if you're out walking, you have on a mask, someone rides by on their bike and sneezes and coughs, and you walk into those, the aerosolized droplets, and they're positive. Okay, your mask does protect you some, but if they fell on your hand, and then in that short time frame where the virus is still alive on your hand, you go and you rub your eyes or you rub your nose, then you can potentially infect yourself that way. So that's what the hand washing and the alcohol, use is for, is because we touch our faces way more than we think we do. Most people do. I know I do because I have allergies, so I'm often with a tissue type thing. So that's what that's for, is to any bacteria that may have fallen onto your hands or your fingers, to give them a chance to be eliminated through the soap wash or through the alcohol wash, so that you don't transmit them to your mucous membranes, your mouth, your nose, your eyes inadvertently. Hope that helps.
Wow. No, that helps. And there's a lot of conversation about when you come back in from being out in the general public, that you should take off your shoes and take off your clothes and immediately throw them in the washing machine or spray them down. Can you give us a little bit more insight on that?
Sure. Some people have their rituals down, and I'm all about that. But I'll just tell you about myself. Since this has started with me going out, I have 3 pair of shoes. I got the work shoes, have the sneaker shoes, and another pair of shoes. And since this has started, all 3 of those pairs of shoes live by my door. Some people have a mud room. They would live in my mud room if I had a house that large. They have a mud room. And these are the only shoes that I wear going out in public. And when I come home, they stop right there at the door, and stay there, and I'll spray them down with Lysol. And then I'll immediately come in, especially if I'm at work. If I'm at work, then everything's coming off at the door, okay? If I'm just out to go to the grocery store, then what I have worn while being out for several hours, because now it's taken several hours just to make a trip to a grocery store or anywhere else, that could be a whole day affair because of all the stuff that's going on. When I'm coming home, those clothes are immediately coming off and going into the hamper. If they're in the hamper, that's fine. You don't have to wash right away kind of thing, because most people have their hamper separated into a place in the house, that's not in their living space. So that's fine. Just don't use those clothes again until you have had a chance to wash them, Depending on how you feel. Some people are just feeling more comfortable to go in and, taking a shower or a bath right after. You don't have to, but you should definitely wash your hands, soap and water, or use the alcohol, and with paper towel or something, and throw that away, as far as just your personal body. So those are things that can help you, because the virus can stay on surfaces, and that would be a whole other talk if we get into all of that. But the virus can stay on different surfaces, depending on temperature, depending on the type it is, for anywhere from minutes to hours to days.
Yeah, so just for full transparency, when I get out of my car, I spray my car down with Lysol. My seat, I use a Clorox wipe to wipe down my steering wheel, and even though I'm wearing gloves while I'm out, and I just properly discard them in the trash can, not on the ground, people. Then I make sure that I wipe all of that down. But I'm a little bit of a germaphobe and over the top anyway, just in routine in general. My friends can tell you. So I want to answer this question, and then we will get ready to close out. Should an essential worker quarantine himself or herself from the rest of his or her family, spouse, and children in the family home every day, even if they're not showing any symptoms of COVID-19?
I would highly recommend it unless you have access to testing and quick test results. You know, if as an essential worker myself, it's just me, so it's easy. But if I had kids or a significant other in the home, then I would be quarantining myself to the other bedroom. You know, unless I know, okay, I've been tested and today I don't have the virus. So today I don't have the virus, so we good, you know. But you know, and that you testing is poor right now. I think in the United States, that's just my personal opinion. Certain states worse than others. In these United States, even frontline workers aren't able to get tested as frequently as I think that they should. So I would quarantine myself from the other members of the home unless you know without a doubt that that day you took a test and that day you got your results back saying they were negative. I would practice some type of quarantining, use one bedroom, you know, use your own set of utensils, do the whole leaving the shoes and the clothes type of thing. And that's not to say that you can't see the other people or things of that nature, because you know they're teams. You know, the wife's coming in, she's taking off her things, the husband's picking them up and with gloves on and putting them in the hamper or putting them in the washer for her while she goes and shower, you know, that kind of thing. So there are ways to make the teamwork, you know, work inside the home, but some level of safety definitely should be practiced daily, especially if you don't know for sure, because the last thing you want to do is bring this back home to your family.
Absolutely. Well, Dr. Woodard, this has been incredibly informative and so helpful. I always love our chats. You dial it down, you make it simple for those of us that are not scientific to be able to understand and be able to protect ourselves and make very informed decisions. So can you tell our audience about any special projects that you have going on or anything that you have if they want to continue to engage with you?
Sure. So let's see. Sherica has a link that I think she'll share with you guys. That is my Amazon author page, which lists all of the books that I have out. I have Doctor's Devotion, Your 1 Month Prescription, the book, as well as the workbook and journal that accompanies that. I also have two journals. Well, it's the same journal, but one's in pink and one's in green. You know, to appeal to the men and to the women. You know, women like the pretty pink. You know, men are more, you know, manly. So want something, don't want to be walking around with a pink journal in their bag or whatever. Some do, some don't. So all these things are on the Amazon website. They're also on our webpage, TW Med Consulting. I am offering a bundle because the book, the Doctor's Devotion book and the Doctor's Devotion workbook are both $15 each at Amazon. Amazon does not allow you to do bundling, but I do have that bundle available at the website, www.twmedconsulting for $25. That will be shipped directly to you. The journals are just $9.99 each, both on the website and on Amazon. And the journal basically came about for patients that I've had through COVID, and it is called Combating Cabin Fever, a guided journal for anxiety while at home or the hospital. So it's more of a guided journal. It'll take you through, oh my gosh, almost 3 months of daily thoughts, affirmations, quotes, things of that nature, as well as place for you to write and kind of chronicle your journey and what you're feeling and what you're working through throughout this COVID virus that we have. So those things are available. And I do recommend that any of you who are interested in this or other topics to go to twmedconsulting.com. We do have just like a contact us or sign up for the blog and the newsletter. You only sign up once. You will get the annual newsletter as well as just a notification of when I have a new blog post up. I have over 2 years, like 2-3 dozen blog posts available at the website now for you to peruse and to learn stuff from. And basically you'll just get an email about once a month saying, hey, she's posted this new, you know, if it's good for you, if you know, share it, comment on it, or what have you. So please go to the website to sign up to get that. That is free information. And I was actually thinking about doing probably next month, waiting for a few more things to come out in regards to COVID-19, a newsletter. So this year, instead of annual, I guess we're going to have it twice a year because so much is going on. People want more information so that I can collect this data from Sherica in regards to this talk to be able to address a lot of the questions that we weren't able to get to today. Those questions will be answered in that newsletter that will be going out within the next 30 days. But again, you sign up at the website, and we'll post that at the end of this as well. So you can have information to that. Access to that free information. Okay, so this is the book. Where does it go? Sorry.
Yeah, it won't let us see it. It won't let, now we can see it.
This
now we can see it.
And it has a journal that goes along with it. And the journal is a true large journal. Like, it is 8 by 10. So this is the book, and this is the journal that goes with. These, like I said, are on Amazon, and they're also bundled for a cheaper price at the website.
So all of Dr. Woodard's information and how you can contact her and order her materials has been placed in the chat. Of course, we will reshare that as well. Thank you all for joining us. It's been a pleasure to host you. I hope you found this incredibly informative. What you will get as soon as we end this webinar is a survey about this session. We ask that you would share your comments, your feedback to us. It helps us get better. We'll be sure to share that with Dr. Woodard. Dr. Woodard, thank you so much for your time. We do hope that you all will join us for our next segment this evening at 7 p.m. as we continue this discussion, and that you will follow us at Total Woman Summit on Instagram and sign up for our newsletter at TotalWomanSummit.com. Thank you all so much. Thank you, Dr. Woodard. Have an amazing day.
Thank you. You too, Sherica. Speak soon.